All right, so we're talking about the heart today. I'm on the wrong slide. We're talking about the heart. We're doing the lab information you need to know about the heart. Let's start with this. It's kind of hypnotic. We're going to be talking in lecture about the electrical activity of the heart. The electrical activity of heart, you have seen plenty of times on like TV shows, right? This thing, this ECG or EKG, same deal. That is the electrical activity of the heart. And this particular image shows you that when this little bump is being recorded by the device, that is the contraction of these two chambers of the heart. The two smaller upper chambers of the heart are called the atria. And then when this gigantic spike happens, that is contraction of the ventricles of the heart. We'll be talking more about that. It is good to remember at this point that there is a word for contraction of a chamber of the heart, and that word is systole. I know it looks like systole, but it's pronounced systole. Systole is contraction of a chamber of the heart. And whenever you read about atrial systole, that's going to be the contraction of the atria, the two smaller upper chambers. When you read about ventricular systole, is contraction of the two lower, larger chambers. However, if you just read about systole, they're talking about the ventricles because the ventricles are so important. So let's move on to talking about the anatomy we learn today. Let's start from the outside. First of all, you should know that the heart sits between the lungs right here behind your sternum. And the sternum is primarily responsible for protecting the heart from injury. It sits in an area called the mediastinum, right? The mediastinum is the area between the two lungs inside of the thoracic cavity. But it sits in its own little compartment, and that compartment is called the pericardial sac, or for AP120, I usually just refer to it as the pericardium. The pericardium is a complicated structure. To understand how it's constructed, I want you to imagine a great big bubblegum bubble, right? The bubblegum bubble is going to end up being our pericardium, right? And my fist, this is going to be the heart. If I push my fist into the bubblegum bubble, what's going to happen? Some of that layer of bubblegum is going to be attached to my fist, and some of it's going to be out here, and there's still going to be a space between the two of them. In this analogy, the heart has got visceral pericardium directly attached to it. It's not shown here yet. And then there's a little bit of a space that has some lubricating fluid. And then on the outside, the loose part that could easily be peeled off is the parietal pericardium. That word is parietal. Although you might spell it right if you call it parietal or something like that. Whatever makes you spell it right. So you can see that this is the pericardium, and this loose part that if I took a heart out of your body, I could easily peel it off. That's the parietal pericardium. Now, the parietal pericardium is actually attached to your diaphragm. Do you see how this is attached to the diaphragm? This is important. You would notice if I, boom, instantly took away your pericardium because your heart is kind of dangling off of these major arteries. And if the pericardium were not there, then every time your heart beats, it would just be like swinging around inside of your chest and bonking into your lungs. You don't have to worry about that because you've got your pericardium. Now, if I were showing the visceral pericardium, I might be pointing to somewhere like this and say, name the connective tissue that is closely adhered or attached to the structure of the heart. And that would be your visceral pericardium. And in between the two layers, there's not air, like in my bubblegum example. There's a little bit of slippery fluid, which keeps there from being any friction as your heart is doing its contraction and relaxation. So we're looking from the outside, and a couple of points I want to make from the outside. We'll be talking about the right side of the heart and the left side of the heart. And so I think we have a tendency to think about Valentine's hearts, but the human heart is not symmetrical like that. The right side of the heart is on the right side, but it's also towards the front. And the left side of the heart is on the left, but also towards the back. I like to say that the heart is twisted, which sounds like a song I made up sometime. But here's the right atrium, and you can easily see it because it's on the right, but also on the front. And here's the right ventricle, the larger chamber of the heart on the right, but really kind of in the front. There, you just see part of the left atrium because the left atrium is kind of around towards the back, and you only see part of the left ventricle because, again, it's more towards the back. Let's talk about the atria. The atria are the upper chambers of the heart, and they're the smaller chambers. The ventricles are the larger chambers, and they are the lower chambers. The pointed end of the heart, where the ventricles are, is called the apex of the heart. That seems confusing to me because I always think of the apex as being the top, but it's the pointy part, so that's the apex of the heart. Each of the atria, when you look at them from the outside, it looks like it's got an ear on it. And what's the name of your ear? It's called an auricle or pinna, right? So when anatomists were naming this ear kind of flap that's on the atrium, when you look at it from the outside, they named it the auricle of the right atrium, the auricle of the left atrium. I want to talk to you about this thing, the fossa ovalis. The fossa ovalis is something that you can only see if you're looking inside of the right atrium. You don't see it from the outside, okay? Looking inside of the right atrium, right at this spot, you'll see a little depression that's made out of scar tissue. And that is known as the fossa ovalis, which is cool because remember when we were talking about bones, a fossa was a depression? It's a depression. And this one is shaped in an oval, so it's the fossa ovalis. The fossa ovalis is a scar. It is what's left over after your heart has healed up a little hole that when you were still inside of your mama, it connected the blood in the right atrium to the blood in the left atrium. So here's the right atrium, there's the left atrium. There is a connection between the two when you're still inside of the uterus. Once you've taken your first few breaths of life, this hole between the right and left atria, that hole closes up and it leaves behind a scar that is called the fossa ovalis. You don't need to know what it was called when you were still inside of your mom. You may have heard of babies that are born with a hole in their heart, and you might have imagined blood like squirting out, but that's not what happens. It is a problem. If it doesn't close within a few days, then it needs to be corrected with surgery. But there you go, the fossa ovalis. If on your lab models, the fossa ovalis is kind of like right there. I don't think we can see it on this particular image. Let's review the idea of the atrium and the ventricle. The plural word for atrium is not atriums, it is atria. So you have two atria and you have two ventricles. The right atrium, remember, is going to be on the person's right side. All of these images are as if I'm standing in front of you. This is my right hand. So that is my right atrium. Right? The ventricles are the larger lower chambers, and this pointed part of the heart is called the apex. Let's look a little bit at these blood vessels. The blood vessels are colored blue and red. And the reason that they are colored blue and red is to give you an idea of what kind of blood is traveling through them. The blood vessels that have got this blue color on these images, that is blood that is low in oxygen and very high in a waste product called CO2. Blood that is red is blood that is very high in oxygen and low in CO2. Now, blood that's coming back from having delivered oxygen to all of your body, it's run out of oxygen and it picked up the waste product of CO2. So as it's coming up through the inferior vena cava or the superior vena cava to drop blood off into the right atrium, it's low in oxygen, high in CO2, and it's blue. And actually, you're used to your veins looking blue, right? Now that blood is going to go from the right atrium down into the right ventricle. It's still blue. When it leaves the right ventricle to go into the pulmonary arteries, this is the pulmonary trunk and it splits quickly to become the pulmonary arteries. When it does that, it's still blue. Why? Because it has not had the opportunity to pick up oxygen yet. It's going to go out to the lungs, pick up oxygen, and as it comes back, it's coming back to the heart through the pulmonary veins, but it's red. So blood in the pulmonary veins is red. Why? Because it lost all the CO2 waste it was carrying, it picked up oxygen, and now it's going to come back through the pulmonary veins, drop the blood off in the left atrium. The left atrium is going to push blood down into the left ventricle. And from the left ventricle, the blood is going to go out the aorta. You can't see that connection. And we will pick this up on our next video.